Senator, for giving me an uninterrupted opportunity to represent the harm that is coming to the patients in the American hospitals and the lack of early intervention. My name is Nichole Sireotek. I'm a registered nurse. I've been a registered nurse for over a decade. My specialty is critical care, trauma and flight. Poor public health measures and poor execution of appropriate early intervention strategies and the handicapping of medical professionals doing their job has led to where we are right now and into the crisis situation that we are in. My story actually begins back in May of 2020. I was one of the original nurses that went to NYC to help with the COVID pandemic because, as we remembered, they needed nurses, and most importantly, they needed ventilators. Well, I was the whole package, a flight nurse that can manage ventilators. And when I arrived there, the gross negligence and the medical, malfeasance that happened in there and the complete medical mismanagement of these patients is what has led us to the situation that we're in right now.
Number of deaths, the number of deaths in New York City, New York State had the highest death rate per capita in the world. Last time I checked, it was 1,600 people per million residents.
If they're on a ventilator, they're not getting basic standards of care. I've had patients that haven't been bathed, haven't been fed, haven't been given water, haven't been turned. And if you ask me, this isn't a hospital, this is a concentration camp. I'm not, even though I founded American Frontline Nurses, I've traveled extensively to South America, India, and South Africa, working in hot zones, stopping the spread of the virus, and working with early intervention. And nowhere in those countries, in developing nations, do I see these issues that we see here in the United States.